Welcome everyone. If you're just joining us, we're in San Antonio, Texas with Dr. Barlow. We're back with him after he's flipped his patient from doing the liposuction on the back. Now we're here doing the front, working on a mastopexy revision, a brachioplasty, and an axilloplasty. And then we'll also be doing a dog ear revision, as well as finishing up the lipo with Renevion. If you guys have any questions, feel free to ask in the comments below, and we'll do our best to answer those for you. If you're interested in seeing the full procedure that's being performed this morning, you can head on over to our YouTube channel. That link is going to be in the bio in the link tree. Lastly, if you're interested in scheduling a consultation and you're watching on our TikTok live, you can do so by filling out this get a quote form. When you fill that out, someone from our team will be in contact with you today to help schedule that consultation and also discuss financing options with you as well. If you're watching on our YouTube live and you want to schedule a consultation, you can swing by to our TikTok live and fill out that form, or in the description of the channel there should be a link tree where you can fill out the VIP Express form. Welcome if you're just joining us. We're in San Antonio, Texas with Dr. Barlow. He's doing a revision on a dog ear and a mastopexy. He's also doing a brachioplasty and an axilloplasty, and finishing up some Renevion and lipo 360. If you have any questions, feel free to ask in the comments below, and we'll do our best to answer those for you. If you're interested in scheduling a consultation, you can do so by filling out this form on our TikTok live. And we'll have someone from our team get in contact with you today to help schedule that consultation and also discuss financing options with you as well.
dancing? Yeah. It's definitely got a lot of Hollywood in it. But I actually met those guys and got them to sign all 3 of their bottles for me. Both sold them with me. The cool thing about that is there's 4 of them that got together, and they were actually given one of the last steel beams from 9/11. They took that metal and they made
Roxy, yes, we are currently in surgery with Dr. Barlow. If you would like to see the full surgery being performed, we are live on our YouTube channel.
Last year for Veterans Day, they were in town, and my wife said she was getting
You're welcome, Roxy.
It is very, very good. Honestly,
if you're just joining us, we're in San Antonio, Texas with Dr. Barlow. He is doing a revision on a mastopexy in the dog ears. The dog ear is that extra skin that's at the tail end of the tummy tuck scar on your hips. And then he's also doing a brachio and axilloplasty, and then doing liposuction as well. If you guys have any questions, feel free to ask in the comments below, and we'll do our best to answer those for you. And if you're interested in scheduling a consultation, you can do so by filling out this form. When you fill out that get a quote form, we'll have someone from our team get in contact with you today to help schedule that consultation and also discuss financing options with you as well. If you're watching on our YouTube live, you can swing on over to our TikTok live to fill out that form, or in the description of the channel there is a link tree with a VIP Express form in it. And once again, guys, if you have any questions, feel free to ask in the comments below. I can ask Dr. Barlow. Give me 1 second. When would you want to start like laser treatment for scars after a tummy tuck? Would it be after the first year?
Usually I like to wait a year. If there's clearly stuff with pigment that's not going, or the redness isn't fading out, then 6 months would be the minimum. But there's so much still happening, I like to give the body that shot of doing it the normal way.
Yeah.
Before we add a bunch of other modalities.
So, Dad, if you didn't really hear him, he said he prefers to wait a year so the body can do all the healing and coloration stuff naturally. But if you feel like it's not healing properly, like maybe it's a little too red or it's healing more darker, the minimum time before you can start is 6 months. Welcome. If you're just joining us, we're in San Antonio, Texas with Dr. Barlow this morning. He is doing a revision on a mastopexy and some revision on dog ears. The dog ears are the extra skin that are at the edges of your tummy tuck. And then he's also doing a brachio and axilloplasty. And then some lipo with Renuvion. If you guys have any questions, feel free to ask in the comments below, and we'll do our best to answer those for you. If you're interested in scheduling a consultation and want to find out more about financing options, go ahead and fill out that get a quote form, and we'll have someone from our team get in contact with you today to help schedule that consultation and explain those financing options as well. Brittany, how often do you have to do revisions on the dog ears? It varies from patient to patient. It could be how the previous surgeon might have stitched up the wound, stitched up the tummy tuck. It also could be because maybe the patient has lost a little bit of extra weight since getting the tummy tuck, causing there to be that extra skin on the side. So it just varies. And it's not uncommon for any kind of procedure to have revisions. You're welcome, Brittany. Roxy, thank you for all the love, all the gifts, all the likes. We appreciate the support. Thank you so much. So Marianne, I'm not allowed to show the surgery on our TikTok, Instagram, or Facebook lives if we're on those. But when we are live on YouTube, I can show the full surgery, which we are today. So if you would like to see the full procedure that's being performed this morning, you can head on over to our YouTube channel, which that link is going to be in the bio in the link tree. Thank you.
My wife would always sneeze 3 times before she got pregnant. Then now she only sneezes twice, and my son sneezes twice. So she's just one of those sneezes. Weird.
Surprise bar. There is a little bit of music playing in the background. We just don't have it super loud. And both Justin and Dr. Barlow are talking a little bit between each other. You just might not be able to hear it.
Really loud. He's yelling. He's really exceptional. There's no way it's real. It's overdoing it.
I would say for the most part, though, a lot of the doctors do listen to music. I don't think I've ever really been in an OR where the doctor is not listening to music unless we just forget to turn it on. Roxy, do you recommend?
One doctor in 24 years that would not listen to music.
Really?
One.
Like,
Pain.
I couldn't do it. No thanks. Roxy, we recommend that you be at your goal weight when you want to come in for surgery. Now, if you are having trouble getting to your goal weight, excuse me, sorry. If you're having trouble getting to your goal weight, we can prescribe the skinny shot. So think like Manjaro, Ozempic, Wegovy, stuff like that. We can prescribe that. We can also, so you can get to your goal weight. But you definitely won't want to come in for your surgery before being at your goal weight. You can have your consult so you know what you're getting into, and then also start the payment process as well for your surgery as you're getting to your final goal weight. We also want to make sure that your BMI is under 35 as well. Surprise Barn said that he used to work in an OR in New Jersey, and they always had the music so much louder than like we have in here right now. I feel like some doctors listen to it fairly loud, but I would say for the most part, our doctors here listen to it at a what I would consider a reasonable volume. I mean, if you feel like your BMI is too low, it could, like, obviously you don't want it too low because you are going to be going under general anesthesia. Plus, depending on what you want to get done, like say lipo or a BBL, you're not going to have enough fat on your body in order to get those types of procedures done. Because there's a lot they take into consideration to decide whether or not you're a good candidate for surgery. It starts with knowing what your BMI is, and then they go into more detail throughout the process. You know, and say you want a BBL. Obviously you can adjust your diet to help create a little bit of that extra fat. That way you'll have that extra fat to pull and then transfer into the rest of your body. But honestly, if your BMI is too low and you're wanting to do something like a BBL, a lot of times the butt implants look really good, especially on people who are on the thinner side. I find them to be more complimentary, and I also just like the look of the butt implant more than the BBLs for the most part.
My favorite surgery. I love implants, butt implants.
I just think they look
So much better.
yeah. Who's not wearing gloves? I'm confused. Both Barlow and Justin are wearing gloves. also not the one operating. I'm just here for social.
You know who James B. Scrubbin is?
I don't think
No.
so.
He's a scrub tech. That does a lot of TikTok stuff. He's hilarious. Apparently Dr. Phillips knows him too.
Hmm.
Yeah, in person.
So with everything that the patient is getting done today, it's about 3-4 hour surgery, since we did have to flip the patient. But time varies from doctor to doctor. Some doctors are a little bit quicker, some doctors take a little bit more time. It just depends, and it also depends on how many procedures a patient is getting done at once. That affects the time, or timing for surgery. And keep in mind that you don't have to get all these procedures done at once. We do it because, like Dr. Barlow was saying earlier today, it's about being efficient, but it's also about safety, and it's also about what the patient's preference is as well. So safety comes first. We would like to be efficient, but if you're not comfortable with being under anesthesia for that long, we'll break up the surgeries. That's not a big deal.
When using Galiflex, do you use drain as well?
Behind you, Justin. Is she getting drains because of the dog ears or because of the arms? The arms? You're not having suction again? Oh. That is a good question. If someone's getting a tummy tuck and an arm lift, they'll have drains in both their stomach and their arms, correct?
Correct.
So what device would you get to hold like the little, yeah, I don't think I can say that on TikTok, but essentially yes. The bowls. What do you get to hold them for your arms? Because I know they have the pouch for your stomach. So they'll be able to sit in that same pouch. Oh, that's good. I don't think I've ever fully seen an arm lift yet, so. Oh, Brittany, that's so exciting. That's coming up very soon. Brittany said that she's getting both her tummy tuck and arm lift with you, Dr. Barlow, at the end of August.
Oh, nice. Hey. Something to look forward to.
Yes. I'm sure you're super excited for your surgery date to come up. I know I would be. You're definitely in good hands with Dr. Barlow, for sure. Welcome if you're just joining us. We're in San Antonio, Texas with Dr. Barlow. He is doing a revision on a mastopexy and some dog ears. The dog ears are that extra skin at the ends of your tummy tuck scar, or at the end of your tummy tuck in general. And then he is also doing a brachio and axilloplasty. And then doing some lipo with Renuvion as well. If you guys have any questions, feel free to ask in the comments below, and we'll do our best to answer those for you. If you're interested in scheduling a consultation, you can do so by filling out this Get a Quote form, and we'll have someone from our team be in contact with you today to help schedule that consultation, and also discuss financing options with you as well.
Have a nylon back there? Like drain through? Yes. Yes, sir.
Remember, guys, if you do have any questions, feel free to ask in the comments below, and we'll do our best to answer those for you. If you're interested in scheduling a consultation and want to find out more about financing options, you can fill out this Get a Quote form. Remember, what you pay for the consultation does go towards your surgery, and you can do the consultation virtually or in person. Also, if you would like to see the full procedure that's being performed this morning, we are live on our YouTube channel, and that link will be in the bio in the link tree.
That's what I was going to say, because her motion is like this whistle attitude. Every time I hear it going off, I think about my son, and I think that's why he was doing it. He knew there was a
Because he
camera
heard,
there,
okay.
and he heard his whistle
Like
attitude.
you're on camera.
Do you need me to grab it?
If you can.
Yeah.
So that's all. Hey, baby. Put on speaker, please. Hey, my love. Now I can. Oh, good. Hooray. Yeah, I was wondering how the ice is holding up. Yay, good timing. Okay, awesome. Perfect. Okay, thanks for letting me know, love. Love you too. Bye. That's normal. Thank you very much.
You're welcome. Okay, so Joyful Love. So what's happening with the area that Justin is stitching is that's where they've cut to do the brachioplasty, which is your underarm, which is where Justin is stitching right now. The axilloplasty is that area from her armpit to the side of her boob. And then underneath her boob, that's where they've done the revision for the mastopexy, just to take off some of that extra skin.
If you hadn't been doing an axilla, it wouldn't have needed to come off, but since we're coming here, I'm like, well, we can get some more skin out.
Yeah. But good question.
The whole thing. That's a nice buttery fat.
Yes, Joyful Love. So that is what Dr. Barlow is doing is the liposuction. So he's already gone in with the vaser to help break up the fat a little bit, kind of liquefy it, and then now he's going in and sucking it out. Tootie Francis, was there a question that you had? Because I didn't see it. Sometimes TikTok filters out questions and I can't see them. So it's not that I'm ignoring you, it's just that I can't always see them. Definitely having 4 kids and coming in for surgery can be hard, especially if you don't have any additional help with the kids. So, you know, with our patients, we always make sure that they have a caregiver to help them after surgery. And that's not just helping them. Like, you know, we want to make sure that there's someone there to help them with their kids or like with their animals. Because when you're done with surgery, you can't really cuddle up with your animals just because you don't want to, you know, take the chance of getting like a piece of your animal's fur where your incision is that could cause an infection. Oh, yeah, no, I can definitely agree. Having 4 kids, having 1 kid in general, does a toll on a woman's body for sure. Doesn't matter. 1, 4, it does a lot to you. And I'm glad that you appreciate, uh, you know, the education. That's the main goal of why we go live, is that we want to make sure people are properly educated on these procedures. That's one reason why I personally like being able to go live on YouTube when patients consent to it, just because other patients or future patients can see what they can expect when it comes to surgery, and ask those kinds of questions of, you know, well, what's this gonna look like, you know, what's the process like. I've had a lot of people come into the lives and say, you know, it's given them peace about getting surgery because now they can actually see what's going to happen and what to expect. It's not as scary for them anymore. Okay, so what she is getting done today, so we started with her prone, meaning she was on her stomach, and Dr. Barlow went in and did liposuction on her back because she's getting lipo 360. After he was done with that and did the Renuvion, which is a tool that heats up the skin to help shrink it, which is actually what he's picking up right now. That's the Renuvion. When we flipped her, he went in and cut off that extra skin that's under her boob, in her armpit area, and on her upper arm, which is the axillo and brachiopplasty, and the revision on the mastopexy. And that's removing the extra skin. So that is up to you. It also depends on, you know, your overall health, how many different surgeries you can get at once. So for example, today she's getting 1, 2, 3, 4, 5 different things done. And it's going to take about 3 to 4 hours for Dr. Barlow to finish. So, and that, you know, that was something that this patient and Dr. Barlow talked about before coming into surgery today, about how much she wanted to get done at once. So if you're uncomfortable with being under anesthesia for that long, you can break up your mommy makeover into a couple different surgeries. We always, of course, have the preference for your safety first, and then we also want to be able to be efficient at the same time. So if we can, you know, do the upper half of your body for one surgery, for example, that way you're healing all in one spot, and then do the lower half of your body on a second surgery date, we can do that. That way you're not hurting all over. So it just varies from patient to patient. So the highest BMI you can have in general for surgery is 35. Of course, you would want to have not a super high BMI for a BBL, but a decent enough BMI to where you have enough body fat for us to be able to take out and put into your butt for that BBL. So if your BMI is at 31, I would say that is definitely good for a BBL. It just also depends on what else you would like to get. Because remember that some of those fat cells will kind of die away with the BBL as well, and that's just normal. That's going to happen. Doesn't matter who the patient is. Or if you continue to lose weight after you get your BBL, your butt might shrink a little bit because you're burning that fat. appreciate all the questions today, guys. These have been really good questions today.
Everybody's shy, you know,
Yeah, don't be shy. Ask the questions. We want you to ask the questions. Because if it's something that I can't answer, thankfully I've been able to learn a lot just from being in the OR and having to answer similar questions over again. But there's also questions that I know I can't answer. And if Dr. Barlow is available for me to be able to ask in the middle of surgery, I gladly will. If we can't answer them right now because he's very focused on what he's doing with surgery, no worries, we'll save the question and we can always do it in a later video that can be posted. Or sometimes what he does is we'll go live for a Q&A outside of surgery where you can talk more directly to him as well. Martha, yes, Dr. Barlow does do surgeries for the face, so neck lift, facelift, brow lift, bleph, rhinoplasty, all of those. Yeah. One TikTok user asks, is it okay to get a BBL done with a herniated disc if it is causing sciatica?
It won't make it better or worse. Now, I guess something to be aware of after BBL, we have some positioning restrictions, which maybe wouldn't be welcome to your back. It just depends, because usually we do like you're trying to lay flat-ish, there'll be a cushion behind your thighs and at your lower back, so your bottom is not really getting pressure. Which I guess potentially could aggravate a back pain, and maybe that's the position you need when the back doesn't hurt. It's just hard to know which way the herniation's going. Is it a lordosis or kyphosis or all those good technical things. Yeah, does not rule one out.
So getting the BBL wouldn't affect, making the herniated disc or the sciatica worse. The only thing that you have to worry about is whatever your pain level is going to be because of the positions that you have to lay or sit in after getting the BBL done. So something else, if that's an issue that you're worried about, we would recommend maybe that you go see whoever your pain specialist is for your back. Ask them what tips or tricks they have for how to handle the pain when getting after you get the BBL done, because that's very common. Like our surgeons here will work with other doctors that you have, like if you have any heart issues, they'll work with the doctor that you go see for your heart, or if you have really high diabetes, they'll work with your primary care doctor, whoever is helping take care of you for whatever other medical needs you have outside of the surgery. Oh, so good that you got your first injection. I know those tend to be very helpful. They help subside the pain for at least 3 to 6 months, depending on how bad the pain is. So I'm very happy that you were able to get that done. And it's good that you did see a specialist and that she said it was okay. So if you want to get another opinion from a different specialist, you can always do that. It never hurts to get more than one opinion. And that's good that you're getting your pain under control. Keep in mind though, before coming into surgery, usually depending on the medication, you might have to stop taking the medication at about a week or 2 prior to surgery. If say that medication is going to affect how your blood clots and also, affects you when you're under anesthesia. So Joyful Love, we definitely don't recommend that you do any of these procedures a week, just because it is a lot of work on your body. It tends to be, a little traumatic for your body, for sure. There are some procedures that they will do under local, like smaller revisions, like smaller lipo revisions they've done under local. I know sometimes when they do the bleph surgeries, which is your you can do an upper bleph, which is your eyelid, or the lower bleph, which is right under your eye. Sometimes they'll have you be awake for that because they need to be able to tell you to blink, and you need to be awake to be able to blink. But it's definitely 100% not recommended to do them under local. You will want to be asleep for these surgeries, for sure.
Huh? Who? No? Why? Was he supposed to? You don't want me here? Come on, tell me the truth. Bad mess with her.
She's on it. She's on it today.
Yeah, I mean, I'm ready. Who's it? Spicy Latino. What? Spicy pepper? I just love cooking. You. Bye. My friend told me the other day, she goes, you know that wasn't very nice, right? And I said, what was it? She goes, I didn't think that was very nice when you said to vagina. And I think your kid was an old.
So the syringe that he's putting in her side, that is an injection of like a pain, I forget the name of the medication, but pretty much it helps relieve the pain for 3 days after surgery. Exparel, that is what it's called. So they'll inject it in that area to help with the pain for the next 3 days.
Sorry. I'm like, okay, well, I'll try better next time. Okay, mommy.
Yeah, we do our best to make sure that we have time to eat. I appreciate the concern.
Yeah.
I didn't get it, not my wife. Okay, sir.
Okay, sir. Thing, like, you think that there's nothing that there's okay, I know my son is. What do you do?
Abby, what is your question from our coming from our TikTok, or not TikTok, coming from our YouTube?
I tried, but
It's still son out now. I'm like, I wouldn't use it.
I gotta get four. It's only 7 hours if I'm in bed at night.
Yeah.
I never am.
You know, I try so hard to like be late early, but by the time I finish procedure, pick up procedure, fall, so it's like, I'm like, what are you talking? And I'm feeling
She is under general anesthesia, meaning that she is asleep for this procedure.
Martin's number? I don't think I do. You call Carlos. He'll have it.
Okay.
So you won't see your final results until about 6 months to a year, just because it takes so long for the body to heal up. But about 4 to 6 weeks before you can start getting back into your normal daily activities. But that can vary from patient to patient depending on how they are healing. And each doctor also has, their own guidelines for post-op care and how long they would like their patients to take it easy for. Not that I have ever heard. I've never heard a patient snore while they're out. Even when they're doing the base stuff and we're more up and close to their face, I've never heard anyone snore. But that is a good curious question. It's something I never thought about.
There's a reason why I'm not home because I'm doing something.
Yeah, so removing that extra skin might help that. Also something that the doctors will do sometimes when they do a lift and a breast implant, so a breast augmentation, is they'll use this little mesh called Galaplex that they'll stitch inside the breast to act like an internal bra for that implant, which helps kind of push the implant in your boobs more inward instead of them like your boobs go like this into your body instead of going out like that, if that makes sense. This patient in particular didn't get that, but I've watched many surgeries now where patients have gotten that Galaplex when they've done a revision or gotten a lift with an implant, and it does make a big difference in my opinion. Yeah, Liv, there's a lot of different technology and stuff like the Galaflex, and even like different techniques with like how they stitch that area of your body to help keep your implants and breasts in place or in that higher, um, the higher profile as well. It's a little triangle of mesh, and it acts like an internal bra for that implant, so it stays further up in your chest. Yeah, so they use the staples to help keep the skin together, creating less tension while they're stitching.
Talk about the staples that I was putting in, but
Yeah.
those are different. Those are absorbable staples
Okay.
that go just under the sub here. They don't hold it in place just like your stitches. But you're right, his staples are what you would expect.
And this is the other one?
Is that stapler?
Yeah. So the one Justin was using, who's the one doing the stitching right here, he just said that the staples that he was just putting in are ones that are absorbed, while the ones that Dr. Barlow originally put in when they made when they cut off all the extra skin initially, those are to help with the tension while making the stitches. Yeah, it's definitely a lot better for patients to be asleep. Even if, you're fairly knocked out and have a little bit of that laughing gas and there's like a local anesthetic in the area of where you're getting your procedure done, it's still just much, much better for you to be asleep for your own sanity, in my opinion. Oh, I'm glad that you're doing well and that you're almost at your 6 months and kind of getting back into your daily routine, especially with that exercise. It's awesome. And I'm also happy that you're, really loving your results. We're not with Dr. Cornejo today. I don't believe he's operating today, actually. But I will definitely pass along the message, Miss Betty. I'm sure it can happen with people being under with the snoring. I personally, with all the surgeries I've been in now at this point, I've never heard it. I've heard it after surgery.
What's that?
Snoring, people snoring, like waking up from the anesthesia, but not during.
Why do you think that is? You know?
I mean, I know they have the, I don't know what the technical term is, but the tube in their
Yeah.
mouth. I assume that helps, you know, them not to snore. Endotracheal tube? Oh.
That makes the snoring sound.
No, that, oh, Dr. Hernandez, that. What Dr. Hernandez is holding up, that is what helps the patient not snore during surgery, but it definitely happens after.
The snoring itself is the soft palate. Those tissues pop around the teeth. The tube, whether it's an LNA or another thing, locks on the tissue on the legs, there's no air for them.
Yeah. So the tube separates the area that causes the snoring. How long does it take for you to actually be able to wear an external bra if you choose? So you'll be wearing a compression garment directly after your surgery, whether it's your boobs or even especially for your tummy as well, to help keep it all in one area. Dr. Barlow, when would someone go back to wearing, like, say, a normal bra after?
Usually 3-4 weeks once the incision is nicely healed. And regular bra won't be able to.
There's no such thing as a dumb question here. Ask all your questions.
You're thinking that someone else is too.
So. So Dr. Barlow said about 3 to 4 weeks. You just want to make sure the incision area is nicely healed before starting to wear that bra again. And yes, it does depend on the person and their healing process. Everyone heals a little bit differently. Buddy and joyful, I 100% agree. With the Texas heat right now, it would be so nice not to have to wear a bra outside.
Or girl. Or Dea. There's another accent.
Single or double?
Single.
Alright guys, I'm gonna go ahead and hop off just because I do need to charge the phones that we're using for the lives. He probably has about another hour and a half left of this surgery in particular. The only thing that he hasn't started on as of right now is revising those dog ears. But thank you guys so much for joining us today. He does have a second surgery after this, so we might be live again depending on what the patient consented for. But yeah, thanks for joining us today, guys, and thank you for all of the questions. We really appreciate it. Like I said, we love when you guys ask questions. But we hope to see you soon, and have a good rest of your day.